Hello everyone. In this video, we will be running through about the basics of electrocardiogram. Electrocardiogram is a widely recognized and more reliable tool used for diagnosing and monitoring many cardiac disorders. This is Shobha, Professor in Medical Surgical Nursing Department, working at MMM College of Nursing. These are the specific objectives outlined in this video. ECG is also known as EKG, that stands for electrocardiogram. ECG is considered as the golden standard investigation in cardiology because of its non-invasive nature and its ability to provide valuable insight into the heart's electrical activity. Electrocardiogram is defined as a graphical representation of the electrical activity of the heart, which is recorded in a specific view. Remember, the ECG records only the current which is produced by the working cardiac muscle. Recording and interpreting the electrocardiogram serves multiple purposes. It rules out the changes present in the cardiac structure, identifies the rhythm and conductive abnormality of the heart. It records the position of the heart and the cardiac chamber size. ECG is considered as the first-hand information for diagnosing any injury happening to the myocardium. Before we discuss about the basic pattern of ECG, it has become mandatory for us to review about the electrical physiology of the heart. As we all know, the main function of the heart is to contract rhythmically and pump the blood to the lung for oxygenation and then to pump this oxygenated blood into the systemic circulation. For this function to happen effectively, there are 5 properties of cardiac muscle needs to be considered. That includes automaticity, conductivity, contractility, rhythmicity and excitability. These properties are the one which is regulating the conductive system. The conductive system is made up of specialized nerve tissue which is responsible for creating and transporting the electrical impulses, which is otherwise called action potential. Electrical impulses is initiated by SA node, which is the pacemaker of the heart. Each impulses which is getting generated in SA node are getting traveled through the muscle fibers of the atrium by internodular pathway and cell-to-cell conduction that causes the depolarization of the cells and also causes the contraction of the atrium. Then the electrical impulses are getting traveled from the atrium into the AV node, or which is called your atrioventricular node, and then it moves through the bundle of His and right and left bundle branches. The left bundle branch has 2 fascicles which is called anterior and posterior fascicles. Then from the right and left bundle branches, these electrical impulses are getting diffused widely through the walls of both the ventricles by means of Purkinje fibers. So after it reaches the Purkinje fibers, it triggers the uniform contraction of the ventricles. An efficient ventricular contraction will be getting delivered within 0.12 seconds. ECG wave sequence are always recorded on a special graph paper that is getting divided into grid-like structure. ECG graph paper consists of small boxes and large boxes. Each small box is corresponding to 1 mm square. ECG paper usually moves at the speed of 25 mm per second. To have clear understanding about the ECG paper, we need to consider about the vertical and horizontal axis of the graph paper. Vertically, the ECG waves and complexes are measured using duration. This is measured either in second or in millisecond. Each small box is equal to 0.04 second or 40 millisecond. Every large box consists of 5 small boxes that is corresponding to 0.20 second. Whereas vertically, ECG graph paper measures voltage or the amplitude of the ECG waves. The amplitude of any waves or complexes are measured in millimeter. When we record the ECG machine will be processing the signal that got picked up from the electrode which is placed over the skin and produces a graphical representation of the electrical activity. The ECG pattern consists of different waveforms that includes P wave, PR interval, QRS complex, ST segment, T wave and QT interval. Before we talk about this basic wave representation, we need to have understanding about the logic present between the pattern of ECG recording. Remember, when the electrical activities are moved toward the lead will be causing the upward deflection, and electrical activity moves away from the lead will be causing the downward deflection. To understand about this upward and downward deflection, we need to have a look on the graphical paper which is given here. Just look on this graph where the P waves which is given here is recorded with your positive deflection, whereas the QRS complex has the mixing of negative deflection and positive deflection. Remember here the positive deflection is otherwise called upward deflection, whereas the negative deflection is otherwise called downward deflection. So when we record this, the depolarization and repolarization of the complexes will be occurring in opposite direction. Now let us see about the wave representation of electrocardiogram. The recorded ECG pattern produces different waves, interval, complexes and segments that represent different phases of cardiac cycle. P wave is the first positive deflection noted before the QRS complex. P wave represents the atrial depolarization and also the atrial repolarization. The normal duration of P wave is expected to range between 0.04 to 0.12 second in duration, and amplitude wise it is expected to be lesser than 3 mm. Next component is the PR interval, which is measured from the starting of P wave to the starting of QRS complex. PR interval is the time taken for transmission of impulses from SA node to AV node. A normal duration of PR interval is expected to range between 0.12 to 0.20 seconds. Any conduction delay happening between SA node to AV node will be causing PR interval prolongation, which increases the patient risk of developing different degrees of heart block. Next component is the QRS complex, which represents the atrial depolarization. The normal duration of QRS complex is expected to be lesser than 0.08 seconds, and amplitude wise it is expected to be 5 mm in inferior leads and 9 mm in anterior leads. Next component is the ST segment, which is the interval between the ventricular depolarization and repolarization. Normally this is present in the isoelectric line, not depressed or elevated more than 0.5 mm. Next is the T wave, which is the representation of ventricular repolarization. The amplitude wise, the T wave should be lesser than 5 mm in amplitude in inferior leads and lesser than 10 mm in precordial leads, that is in anterior leads. We also have the QT interval, which represents the complete activity of the ventricles, which includes a depolarization of the ventricle, repolarization and a pass between the cycle. From the recorded ECG paper, the heart rate of the patient can be calculated. There are multiple methods are available that will be decided based on the type of rhythm patient is having. If the patient has a regular rhythm, we will be using a box counting method for calculating the heart rate. Whereas if patient has an irregular rhythm, we go for QRS complex counting method. To understand about the box counting method, when the rhythm is regular, we go for box counting method. Here, we need to calculate the number of large boxes which is present between the RR interval. After we have seen the number of large boxes, we will be using this formula where the heart rate is equal to 300 divided by number of large boxes between RR interval. So here I want you to understand the reason why we are using the number 300. Usually for calculating the heart rate, we will be considering over 60 seconds. So here each large box is corresponding to 0.20 seconds. If you use 300 into 0.20 seconds, we will be getting 60 seconds. Whereas where we will be using the small box counting method is whenever we have to record the accurate heart rate, or when patient is having the faster heart rate, it is advisable to use the small box counting method, where we go for the formula of 1500 divided by number of small boxes present between the RR interval. So here also the same reason what I told you already. Here 1500 into each small box is corresponding to 0.04 seconds. If you just multiply this 0.04 with 1500, you will be getting the duration of 60 seconds. If the patient is having irregular rhythm, then we will be going for second method of heart rate calculation, that is QRS complex counting method. So here if you look on to the strip what is given here, the distance between the RR interval are varying from each complexes. So that is the reason we consider this rhythm as an irregular rhythm. In this given situation, we need to count the number of QRS complex present over 6 seconds. That will be multiplied into 10. So to understand about that 6-second duration, on top of the ECG strip, if you see, you have a marking given on a 3 places, a black color marking which is given on the top of the strip. Each distance represents 3 seconds. So here for considering the 6 seconds, the distance between all these 3 marking has to be considered. Here we have 11 number of QRS complex which is present. So the patient heart rate is expected to be at the rate of 110. So here 11 into 10 if you give, your patient will be having 110 heart rate per minute. To have a clear understanding about the method of heart rate calculation, here is an example where all 3 methods of heart rate calculation was used. The first method here which I have shown is our small box counting method. So here the number of small boxes present between the RR interval is 27. So for small box counting method, we will be using the number 1500 divided by 27. If you divide this number, we will be getting the answer as 55.6. So the approximate heart rate which is considered for this patient is 56 beats per minute. For the same distance, when we use the large box counting method, the number of large boxes present between RR interval is 5.4. So for using large box counting method, we will be using the number 300 divided by number of large boxes. So here 300 divided by 5.4, if we use the number what we get is again 55.6, where we can consider the patient heart rate as 56 beats per minute approximately. Remember here, by using this heart rate calculation method, the heart rate what we are calculating is not an accurate heart rate calculation, it is only an approximate heart rate calculation. Whereas the third box shows you the QRS counting method. Remember in my previous slide I have told you we will be calculating the number of QRS complex present for 6 seconds. That number will be multiplied into 10. So here there is no marking given on the top of this, where they have considered the number of beats which is present for 10 seconds. So because of that reason, they have taken here the 9 number of QRS complex was noted over 10 seconds. So since we have taken the count for 10 seconds, they have multiplied that number with 6, because we have the number for 10 seconds. We need it for 60 seconds. For that reason, they are multiplying this number of 9 into 6 for considering the heart rate over 1 minute. So that number shows approximately 54 beats per minute. I hope you would have understood about the concept behind the heart rate calculation. These are the references which I have considered to record my video. For your further understanding, you can see all these books. And now we have come to the end of this video, where in this video, I hope you all would have had a basic understanding about the electrocardiogram. So in this video, we were able to have the basic understanding about the purposes of electrocardiogram, reviewed about the conductive system of the heart. We were able to understand about the ECG wave representation, and you had an understanding of how to record an ECG paper and how to calculate the heart rate from the recorded ECG. Where in next video, we will be having the detailed discussion about the leads present in the ECG recordings. Thank you everyone.